So without further ado, I'm going to now introduce Dr. Deborah Stephens, again from Huntsman, who will be presenting preliminary efficacy and safety of MK1026, a non-covalent inhibitor of wild-type and cis481S mutated Bruton tyrosine kinase in B-cell malignancies, a phase 2 dose expansion study. So thanks so much, Deborah.
Thanks to everybody for joining today, and I'm really excited to share this updated abstract today. Here are my disclosures, and the first slide I have really is a treatment schema. This is clearly a large study. I'm really going to only focus on the CLL and SLL expansion cohorts today. However, so you know, in this study, the key eligibility criteria included an age of 18 or higher, CLL or SLL with symptomatic disease, B-cell non-Hodgkin lymphoma with measurable disease, a good ECOG performance status of 0 to 2, or Waldenström's patients with an IgM level greater than or equal to 2 times the upper limit of normal. And you can see all of the expansion cohorts. The CLL group actually had 2 separate expansion cohorts, one with a C481 mutation and one without. You can see all of the different cohorts here of the non-Hodgkin lymphoma group. And this is a therapy that is a continuous therapy. And so treatment was continued until unacceptable toxicity, progression, or withdrawal from study. The primary endpoints for this portion of the study was overall response rate for participants with CLL and SLL. Secondary endpoints included duration of response and safety and tolerability. And you can see here in the center, the recommended phase 2 dosing of this drug was found to be 65 milligrams daily. Over on the left-hand side, you'll see a modified consort diagram, and you'll see that of all patients, there were 122 enrolled, 118 treated on study. Of these, 85 discontinued therapy. 12 were secondary to adverse events, 27 was secondary to a clinical progressive disease, 18 radiographic progressive disease, 8 withdrawal of consent, 18 other, and 1 death. The next graphic just details those patients who were treated at the recommended phase 2 dose of 65 milligrams daily. The central table looks at the baseline patient characteristics, and this is for the overall population. And you can see that the median age was 66 years. The majority of the patients were male and Caucasian, as is typical for CLL. You can see that 57% of these patients enrolled were CLL or SLL. And you can also see the distributions of the different subgroups of B-cell non-Hodgkin lymphoma that were enrolled and will be reported at a later time. As I mentioned, the recommended phase 2 dose was 65 milligrams daily, and about 80% of these patients were treated at that dose level. Over on the right-hand side, you'll see the table that looks specifically at the CLL and SLL patients and contains 51 patients. These were heavily pretreated patients with 4 median prior lines of therapy, but went up to 18 prior lines of therapy. 84% of them did have a prior BTK therapy. Majority of these patients were good performance status, with most commonly having an ECOG performance status of 1 at 63%. Majority of these patients did have IGHV unmutated disease at about 60%. 23% of these patients had deletion 17p, and of these patients, about 63% did have a known C481S BTK mutation. This slide summarizes the key efficacy results for this drug, and it is notable that the overall response rate was around 60%. And you can see the distributions that majority of these patients had either a PR at 32%, a PR with lymphocytosis at 23%, and or stable disease at 40%. There was one patient who did have a complete remission on therapy. You can see the duration, the median duration of response has not been reached down at the bottom there. And among efficacy evaluable patients, 32 had received a prior BTK inhibitor therapy, 4 had deepening of response throughout the study period with PRLs deepening to PRs, and 9 continued therapy at the time of analysis. Among those patients who were evaluable for measuring change in lymph node volume from baseline, 22 had a volume reduction greater than 50%. And you can see of the 33 evaluable that 94% did have a decrease in lymphadenopathy, and 70% of those had a more than 50% increase. So really great efficacy results in this heavily pretreated and very high-risk population. This slide summarizes the key safety results, and you can see that of all patients, 96% did have a treatment emergent adverse event. Of those treatment emergent adverse events deemed related to MK-1026, 66% had these. About 26% had grade 3 or higher related treatment emergent adverse events. There were 8 patients that had grade 5 treatment emergent adverse events, including death after progressive disease in 3, sepsis in 1 patient, dyspnea in 1 patient, and respiratory failure in 2 patients. But none of these grade 5 drug-related AEs were reported as related. The table on the right summarizes the treatment emergent adverse events that were most common, which were greater than or equal to 20%. And we saw this earlier in the question of what is the most common treatment emergent adverse event, and the answer is fatigue, and that 33% of patients had this. One of the options was diarrhea on those questions. However, you can see that diarrhea is lower on the list at 21 with this particular drug. And interestingly, constipation was more common seen with this drug. Dysgeusia was seen in 28% of patients, which is notable as several patients had taste disturbances that affected their appetite. When you look at grade 3 or higher adverse events, these were quite low. The highest one was actually hypertension, which we've seen with other drugs in the BTK inhibitor class. And we also see a little bit of fatigue, constipation, nausea, and diarrhea coming through. But overall, this is a really very well-tolerated drug, obviously leading to great responses in heavily pretreated patients. And so I think that this is really definitely a drug to watch. So in conclusion, MK-1026 at a dose of 65 milligrams has shown promising anti-tumor activity with manageable safety profile in patients with CLL and SLL. Responses were observed even in heavily pretreated patients and in those progressing on prior covalent BTK inhibitors. And evaluation of MK-1026 in B-cell malignancies at a dose of 65 milligrams and higher in different subgroups is currently ongoing.